I knew that I had a non-working interference on my right side, and whenever I was chewing on my left side, I could always feel that cusp.
So you felt like it was kind of rubbing when you?
Yes.
Okay.
Mhm.
And how long did this went on?
I noticed it for about 6 months. I didn't have any pain associated with it. It was just that interference that I could notice when I was eating or chewing gum.
Now, let me ask you something.
I think what probably was the cause was not wearing my retainer after ortho.
Okay.
But
Well-
I did also notice, I had at my cleaning, a dentist looked in and saw some occlusal wear on the mandibular teeth.
On the opposing mandibular
Yes.
tooth. Okay. When that happened, it came more apparent to you that yes, you were having some issues on that side. You never had pain. Did you ever have any tooth sensitivity or any hypersensitivity on that side?
No, none.
No clicking or popping of your joints, nothing like that. Just basically you knew that you were hitting there.
Mhm.
Now, could you feel the pressure on the tooth when you actually were rubbing on that area?
Absolutely, yes.
Okay.
Mhm.
So we did diagnosis on you. Do you remember that I was palpating the inferior lateral pterygoid muscles on both sides? Do you recall having any pain or tenderness on either of these muscles when I was actually performing my diagnosis?
I do remember slight pain when you palpated inferior lateral.
Right. Okay. Now, how invasive do you think the treatment was? How invasive would you consider that selective occlusal adjustment, the one that we perform on you, how aggressive do you think is as a treatment option?
I think it was very minimally invasive. The amount of occlusal adjustment was very minimal.
Did you have any sensitivity while I was actually doing the selective grinding
No,
on
none.
any teeth?
No.
How about postoperatively? Have you had any sensitivity after I completed my occlusal adjustment?
None, no.
Do you feel your teeth that they are too rough, or I mean, do you feel anything different after the occlusal adjustment?
In one little area I could tell it had been adjusted, but
Okay.
it's nothing that would bother me.
Well, one thing. Now, how long did it take you to feel better?
I felt better immediately that day after the first appointment.
How about after the second appointment, knowing that you had a little more adjustment needed?
And then after the fine tuning, I felt even better. So
So how do you feel now, right now? Do you feel that you have still some interferences? Are you able to catch any?
no.
No.
Mm-mm.
So you feel right now that you can function well, that you don't have that rubbing on this right side. That disappeared actually the first day you said.
Mhm.
As a dentist.